This is Dr. Thomas Burnett here at Regeneration, Pittsburgh, and today we're talking with Bob. Bob, thanks for offering to kind of share your story through the stem cell procedure. And I'll kind of just let you take the floor from here and kind of tell us what your experience, what you brought you into this in the first place.
Okay. Dr. Burnett, in the spring of 2017, I started having major problems with my shoulder. It was probably from lifting, trying to push my age a little bit too far. And I finally went to a orthopedic surgeon, and they did the MRI and the X-ray. The MRI came back, I had a torn labrum, I had a torn rotator cuff, my shoulder was out of place, and the X-ray came back, it was arthritic, and I had bone spurs. Now, the orthopedic surgeon said the only way to fix this would be a shoulder replacement, and I asked him if he could just go in and clean it up, and he said no, it was too bad. So, needless to say, I didn't want to go through a shoulder replacement, so two friends of mine at the gym, they previously had stem cell from Dr. Burnett, and so I went out to see Dr. Burnett and probably put this off till September or October of 2017. He looked over my X-ray and my MRIs, and he said, I got good news, I got bad news. I can't correct it 100%, but I think we can get this back 60 or 70%. And I said, that is all I want. I'd be ecstatic if we could do that. I said, it hasn't been 100% for years and years anyhow. So in November approximately of 2017, Dr. Burnett did the stem cell.
The bone marrow aspiration.
Okay, there you go. We'll let him say that, but he did the stem cell. He took stem cells out of my hip, put it in my shoulder. He did everything else. He put me in the bariatric chamber. And gradually, my shoulder is back at least 60 or 70%. It took a little bit of time. The first month, it got a little bit better. A couple months later, it got a little bit better. Now we're 8 months into it, and I'm very, very happy with it. I have good range of motion. I'm getting my strength back, and I'm very vain. All my friends told me the only reason I didn't want shoulder replacement, I didn't want the scar on my shoulder. So, thanks, Dr. Burnett, no scar.
Okay, no, I'm glad you had great results, and this is pretty typical here. I'm glad we got you at least at 67%. That was the goal, right? We had the goal. So, I guess last question I would have for you, would you recommend this procedure to somebody else with similar symptoms to you?
Absolutely.
That's it. Bob, thanks again.
You're very welcome.